got diabetes, I was in the hospital. I went through 2 amputations, actually 3. They had to do the right one twice. They didn't get enough of it. So subsequently, I had to go to a nursing home to recover. And that was a good thing, you know. I did recover, and nursing home is a good thing, don't get me wrong. I didn't like it, but it's a different lifestyle. And I did recover. I got the help that I needed, but I was tired of it. I wanted to get out and be independent again.
I went through a lot of changes in the nursing home. I lived in nursing homes for 13 years. And all I could do was eat, sleep, smoke, stuff like that, which means that I wasn't getting enough from my environment to help me to be stable.
Life was in a nursing home. It was like, it wasn't for me. It was kind of a lot of, I don't know, I didn't feel free.
Who is eligible under the Colbert Consent Decree? All Medicaid-eligible adults with disabilities residing in a nursing facility located in Cook County, Illinois, and who, with appropriate supports and service, may be able to live in a community-based setting. What to expect under the Colbert Consent Decree? Professionals working together with the nursing home resident to maximize his or her abilities and independence, provide information to make informed choices, include whomever he or she wishes in the identification and selection of available options, and to coordinate a successful transition to a community residence of their choice.
The benefits of the program are to transition members from the nursing home facility into a supportive environment, whether it be their own independent apartment or into a supportive living facility. Living in the independent apartment gives you more of a free will to kind of come and go as you wish, and it's more for people who don't require so much support. And living in a supportive living facility is more for those people who requires a bit of assistance with medication management and those who don't feel as comfortable being by themselves in their own apartment. Peace, as well as me. They get me as their care coordinator for a year. And so I continue to follow them, make sure that the services that I promised them before the transition are set up, before they leave the facility and after they've left the facility, that the services continue on and they're being successful in all those services.
There are other benefits to nursing home residents. The resident may need assistance in finding a community residence, assistance in making the community residence accessible, financial assistance to help pay rent and purchase needed supplies such as furniture and household goods to set up the household, help with applying for various government programs, and linkages to community-based services and supports.
So the process at Aetna starts off by the team obtaining medical review information so we can complete a chart review for the member. And this gives us information regarding the member's background, where the member came from, the member's medical diagnosis, and overall just general information regarding the member's health. And from there, the care coordinator goes to the member's room, they interview the member, and first of all start off by asking consent to participate in the program. And from there, we move to the member interview. Now in this process, the member gives us information regarding why did they actually come to the facility, to the nursing home facility, what they actually do, as well as give us information regarding where they would like to move once they transition back into the community. And they also identify in this process a family member that they would like for us to contact regarding who will be a good social support system for the member. From there, we actually obtain the information for the family member, and we conduct the family interview. The care coordinator calls the family member to gain information regarding how much of a support they will be once the member transitions back into the community. We also interview the nursing home staff, and that's again to gain more insight regarding information we need about the member, wherein if the member needs assistance with their activities of daily living, if the member needs assistance as far as receiving community mental health services, if they're going to need assistance as far as getting to doctor's appointments, things of that nature.
So to be able to come to someone who feels like they can't make it because they've been in a facility for 32 years, such as one of the members that I'm working with currently, and he's really struggling with, being able to feel comfortable with knowing that he'll be able to transition and live successfully. And I've just been having constant communication with him and just uplifting his spirits, and to see the small steps that he's taking to make sure that he has everything together on his part, and the phone calls that I get from him every week to make sure that I'm continuing to work with him. It is an amazing feeling to know that you're able to give someone something that they didn't think they would be able to get.
How does one start the process? If you are watching this video with one of the professionals already mentioned, talk to this professional. You can also let us know by going to the website of the Illinois Department of Healthcare and Family Services, where a referral and request for an evaluation begins. Website address is www.mfp.illinois.gov.
It's good. I like living here like this here. It's like home away from home for me. And this time instead of me going to see the kids, it's good that they come and see me for a change.
And then just the freedom, that's pretty much the freedom, eating better, and I can get out and do the things that I want to do, I'm not confined to that unit, and it was crowded in there, I had the freedom, So I'm getting out now every day and doing different things, I pretty much read a lot, so I go to the library, I'm on my computer, and then just anything I want to think about, I want to do for the day.
It's so amazing. It's such a blessing. It's just amazing to be on my own. And everybody says that I'm doing really good. I'm moving on with the programs and stuff like that. And anybody can do it, but they have to set up a strong foundation and believe in the people that are helping them. It doesn't mean you don't get mad, doesn't mean you don't get sad, but you can be happy too. There's another side to it. But it takes a lot of work. And if you're willing to do the work, you deserve it.